Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. I do a lot of facelifts. I perform all sorts of facial rejuvenative surgery, and people often ask me, Dr. Shapiro, what age is the right age, and when am I too old for a facelift? I think the most important thing to understand as a patient is that there is no right or wrong age. I think so much has to do with your inherent genetics, that you can, oftentimes see how you age based upon how your parents aged. So much has to do with your habits in terms of previous smoking or current smoking, sun damage, if there's been a lot of loss of weight recently, that will show on your face. People that present younger, that is maybe in their 30s, their 40s, their 50s, as opposed to the 70s and 80s, oftentimes are great candidates because their tissue tone, the presentation at the point when they come in are younger, and I think their tissue's in better condition in order to get a nicer result for the surgery. That does not mean that people in their 70s and 80s are not great candidates for facial rejuvenation. I think along the lines you kind of have to figure out what it is that you're looking for and what expectations you have. I think universally people find that they lose their jawline, they feel that they are hollow around the eyes, their neck does not have the acuteness or the angularity that they had when they were younger. You may feel that your profile looks more like your mother or father. But all in all, I think it's important to understand that chronologic age is not as bad in your mind or as important as physiologic age. I have patients that come in that are 50 or 60 that have not been out in the sun, have very nice genetics, and their presentation is often like a 40-year-old. So I think the most important thing to figure out as a patient is to stop reading on the internet and come in and get an opinion from a plastic surgeon. What I often do is have you sit down with some photographs of what you look like when you're younger, show you in a mirror, and you show me what exactly it is that's bothering you, and we go through point by point in terms of how to address those things. As long as somebody is medically cleared for surgery and your doctor feels that you could tolerate the anesthesia and the operation, which oftentimes is not exceedingly lengthy, you're a great candidate. So we go through, I think that also the important thing is to understand this elective surgery, and it should not put your health at risk. So come in for a consultation, we'll go through all the possible things that we can do to make you look better and help your self-esteem. Thank you.